all our focus is on the patient, is patient-based. And we have to look at patients not as the diseases they present with, but as human beings. I was born here and brought up in Jos. I've always wanted to help people. I've always liked to help people in all situations they find themselves. And luckily for me, I found myself in the medical career. I could recall the turning point being COVID-19 pandemic. After the losses that exposed the weaknesses and shortages in healthcare practice, I said, look, we really need to get this facility on its feet and then start rolling. And then subsequently, I moved to Jos to start Pulse Medicare Limited. The services that Pulse Medicare Limited provide are due to the immediate needs of the community. The communities that surround us are communities where healthcare is very poor. There are a shortage of facilities that provide these immediate services. So we try to see that we provide all these services in-house so that once the patient comes, the patient will be treated holistically and then decisions can be taken, results will be arrived at early, and then interventions will begin. Nigeria is a country plagued with high maternal mortality and emergencies involving the pregnant woman. I could recall there was a woman that was rushed into this facility. She was taken to a traditional herbalist and they now gave her some concoctions in the hope that it was going to stop. So the bleeding continued and this woman went into shock. So she was rushed into our facility. Through our emergency services, we quickly intervened. The woman was saved. And this was a very proud moment for the family, and it was a very proud moment for us as a hospital. LifeBank, through their services of blood and oxygen, have helped us tremendously in achieving our goals over the years. There was a time we were in the theater, we went in with a pint of blood, and then we needed more blood due to a complication that arose, which we were able to contain. Before you know it, we placed orders to LifeBank because their services are so efficient and so quick. Within a very short period of time, the rider was here, provided us with the blood we needed to save the lives of patients. There's nothing more delightful as seeing you being able to save a life that was thought about to be lost. And then you were able, through your intervention, to bring this life back. The communities that surround us are in their need of healthcare services. Primary services are lacking, many secondary services are lacking. So we believe this is a challenge upon us to stay on our toes, to try and expand our services to encompass all these challenges and be a leader in healthcare practice within Jos and environments.